Hello, everybody. So during this presentation, we're going to talk about exertional heat stroke, not to be confused with classic heat stroke. So I'm sure you're very familiar with this infographic. Okay, so it differentiates between heat exhaustion and heat stroke. About every year around summertime, it circulates through social media like fire. And I will tell you that this is not correct. All right. Mostly because under the heat stroke portion, it says no sweating, and that is grossly inaccurate. Now, a patient with a classic heat stroke, not an exertional heat stroke, might not sweat, but a patient with an exertional heat stroke can most certainly still sweat. Now, heat stroke is broadly defined as a core temperature above 104 degrees with central nervous system abnormalities or altered mental status following strenuous exercise or environmental heat. That's directly from the Wilderness Medical Society. And heat related illness is the leading cause of morbidity and mortality among U.S. high school athletes. And I'm going to say this next statement, I'm going to repeat it. The outcome is directly attributed to both the magnitude and duration of hyperthermia. And that is a key point, that the outcome is directly attributed to both the magnitude and duration of hyperthermia. So all you need is a patient who was outside or in a hot environment with altered mental status. And that is the definition of a heat stroke, because altered mental status is a core feature, and the outcome is attributed to the magnitude, so the severity, and the duration, how long they remain at a high core temperature. This is a more accurate infograph. So on this infograph, you will notice that absence of sweating is not listed, and it says that altered mental status is the cardinal sign of heat stroke. Presence or absence of sweat on skin is irrelevant. And listed below, you will see that cold water immersion, not submersion, is standard of care for heat stroke. So a little bit of pathophysiology that I think is particularly interesting. So essentially, an increase in blood temp triggers the hypothalamic thermoregulation, so it increases blood flow to the cutaneous skin. Increased mucosal permeability from inflammatory mediators then allows endotoxins from the gut, okay, from the stomach, to enter systemic circulation. That cutaneous vasodilation, all right, to the skin, blood shunts the periphery to facilitate heat loss through sweating. So this is kind of like sepsis, because you get these alterations in microcirculation, more tissue injury and endothelial injury, which then further impairs thermoregulation, and you get this massive, overwhelming inflammatory response. An ounce of prevention is worth a pound of cure. So there is such a thing, technically, as a heat vaccine, and that is acclimatization. So, which is you receive small, steady doses, and they do prepare some military personnel for this small, steady doses of exertion in hot environments, and then they get this adaptive response. And there is pretty strict controls and guidelines for this. Now, that adaptation may persist up to a month. Interesting fact, if a person has a heat stroke, they are prone or at increased risk for another heat stroke or heat injury for months. And I think that the length of time that they're going to be prone varies depending on the patient. Hyperhydration, so forced hydration, has no effect on heat tolerance, and it's ineffective and it is dangerous. So forcing someone to drink lots and lots of water is ineffective and it's dangerous, mostly because you can cause dilutional hyponatremia. you'll frequently see, like if you ever do standby events for marathons, they'll have like hydration stations, and they'll also have like crackers or something like that so that they can also get some salt intake. So who's more at risk for heat stroke? Hypohidrosis, so people that don't have the ability to sweat, and a lot of this is an extension of that. So extensive scars, they don't have the ability to sweat, diminished cardiopulmonary reserves in elderly, and a person with an acute sunburn. And even after it appears that sunburn is gone, the effect persists for up to 7 days. Now, this is a work rest cycle based off of the bulb globe temperature categories. And the military uses this religiously. A lot of people use some sort of adaptation, but to do a true wet bulb globe temp, you need a specific device. All right, now there is a, so like this chart, and it says at the bottom, note, this chart is calculated using temperature and humidity, assuming a very clear sky, so the maximal solar load, and a normal atmospheric pressure, et cetera, et cetera. So you can only use this as a guide, and it wouldn't be something that you would really want to use if you're seriously concerned about heat stroke and whether or not your people can continue working or not. So like a person, depending on the activity, a person that's in an unacclimated climate and the heat risk category is high, so a person who is sitting down not doing nothing would be in a different category. So this is for like, they have light work, moderate work, and heavy work. And however long you can work or rest depends on the type of work you're doing. But anyway, so this is a composite temperature, and it factors humidity, sun angle, temperature, wind speed, solar radiation, and it's more accurate than a heat index. And it's important to note that as the environmental temperature increases, the body incurs a net heat gain through both the convective and radiative processes, leaving evaporative thermoregulation as the only cooling mechanisms. Some activities, however, enhance heat transfer. We know water transfers heat much better than air, so and if a person is a cyclist, then the wind is also on their sides. So a person that's a cyclist or a swimmer is at less of a risk of having a heat stroke. So the more demand that is on that person, and the worse the conditions, there should be a proportional response in breaks. All right, treatment. So how do we treat it? So here's a picture that I found when I Googled how to treat heat stroke. And apparently all you have to do is put ice packs in the neck, the armpits, and the groin. Pretty simple, right? But it's not that simple, because years and years ago, the military had a humongous mortality rate from heat stroke, and now they boast a 0 fatality rate from heat stroke. And it's not because they put ice packs in the neck, armpits, and the groin. It's because they started doing things that have some evidence and some science behind them. And the thing with the most evidence, and what is now the standard of care, is cold water immersion therapy, CWI, cold water immersion, not submersion, immersion. It is the optimal field treatment to achieve rapid temperature reduction below critical levels in heat stroke. So remember, the mortality and morbidity is directly related to the severity and the duration of the heat stroke. Ice water cooling is twice as rapid to reduce core body temperature as simply just spraying water all over the body. Now, a lot of people will say, well, they're going to shiver, and that's known as the Curry response. Shivering might increase the core temp by zero point 0.1 to zero point 0.2 degrees Celsius, but hindrance of cooling by heat generated shivering has been physiologically refuted, especially if you're using cold water immersion therapy, because the rate that you're going to reduce the core temperature by is going to outweigh or outpace the climb in temperature that could possibly be generated by the Curie response. You're not going to cause them to go into shock. If anything, the cold water is going to shunt water from the core. They may have a slight vagal response, but they're going to die, or they're going to have some permanent neurological deficits if you don't rapidly drop the core temperature. What about measuring temperature? So the golden standard is rectal and esophageal temperatures. Now, that image on the right is an esophageal probe or a rectal probe temperature probe, which we don't have. So we do have the ability to monitor rectal temperatures. And we should obtain a core temp, but only if it's not going to delay treatment. So obtain a core temperature, a rectal temperature, only if it's not going to delay rapid cooling. Now, if cold water immersion therapy is not available, the best thing is just repeated dousing with cold water, just continuous repeated dousing. Probably the next best thing is ice sheets. So take a bunch of sheets, put them in an ice bucket or a bucket of ice water, and then rotate those out every 2 to 3 minutes. The military has adapted this for desert situations where they don't have large volumes of water. You might have to be creative, right? You're going to need to get large volumes of water over to the patient, or you're going to have to take the patient to a body of water. Now, I'm sure you could come up with 100 different scenarios where you might be in a situation where a patient's having a heat stroke and you don't have any water. You probably could. And I'm sure that it could be difficult in some situations, but if at all possible, you want to treat in place. You want to cool them first. That may mean calling the fire department if they have a lot of water. It may mean once you identify it, calling your supervisor saying, I need a lot of water, or I need ice. I need you to get me some ice. Call somebody, right? Or at the very least, take them to the closest facility where I'm sure they may have a shower or something, and have somebody bring you ice. But at that point, they may not be familiar with cold water immersion therapy, and the patient might not get the treatment that they need. But sometimes you just have to make things work, and this is what Austin Travis County recently did. They had a patient suffering from a heat stroke. They called their medical director. Core temp was like, we'll say 108, and the medical director said, do not transport. Cool the patient before you transport. So they went over to Sam's Club. They used a shopping cart. Sam's Club donated ice and water, and they put a tarp in the shopping cart and filled that full of ice water and immersed the patient. Got the core temp down to around 101 and then transported where the patient could recover. But the longer you delay treatment, the worse the patient's outcome is going to be. Here is a news clip that I saw that was printed on October 27, 2018. Runner dies of heat stroke from white-faced sky race. It says that attempts to resuscitate Marshak proved futile, however, and he died at the hospital. Whitelaw said the ambulance crew initially measured Marshak's body temperature at 104 degrees, and it had risen to 108 degrees by the time of his death. The cause of death was determined to be heat stroke. Before we go on, I want to share another method of cooling a patient, and it's using a tarp. So it's a similar method to this, but you can just make a taco. So you lay the tarp flat, put the patient in the tarp, have a few people on each side, raise the edges of the tarp, and you just fill it full of ice and water. Um, and that's effective. So anything where the water's just not going to leak out would work. But always remember to keep their head up, because you don't want to actually get any water in their airway. So you should never convey your heat stroke casualty to the hospital with a temperature of 104 or higher, right? They should be cooled before you can get them to the hospital. Okay? As always, I hope that you enjoyed this. If you have any questions, I'm looking forward to your feedback and what you think about this new treatment, because it's not really new. It's been out for years. The military has been recommending it. The Wilderness Medical Society has been recommending it. If we're doing a standby event and it's a marathon and the weather's going to be, if it's going to be particularly hot or humid, we can prepare for these situations beforehand so that we don't have to try to do it at the last minute, when we need it. But this is now the standard of care. And I don't think that ignorance is bliss. So saying that, we've always done it one way is not an acceptable answer or defensible reason for not doing something. So let me know if you have any questions, and that's all.